The reason that we run the panel that we do at Galaxy Diagnostics is because most people are more likely to be exposed to a dog, a cat, or a flea than they are to the human body louse that is responsible for transmitting Bartonella quintana. And so when we look at our molecular data, the most common organism that we amplify from human research participants in our study is Bartonella henselae. The next is Bartonella vinsonii, then Bartonella koehlerae, and the least is Bartonella quintana. So it makes sense to have a serology panel that matches what you're finding on a molecular basis and what people are exposed to. Most pathogenic Bartonella species can induce fever, can induce endocarditis and infection of the heart valve, can induce enlargement of lymph nodes, and then after that, the water gets a little muddier as to what Bartonella is doing and what species are more likely to cause that. But one example that I think illustrates the importance of having specific species for your antibody testing is a young girl that over a 3 to 4 year period developed peripheral visual loss, developed hallucinations, developed joint pain, developed abnormal sensations, tingling in the extremities. And when we first tested her, she did not have antibodies because to Bartonella henselae, Bartonella vinsonii, Burkholfi, and Bartonella quintana, which was the three antigens, the three tests that we were doing on a research basis at that time. But we could PCR Bartonella DNA from her blood, but we could not get enough DNA to actually say what species it was. Almost a year or 2 years later, we were looking at Bartonella in cats and finding Bartonella koehlerae. We developed a specific PCR for Bartonella koehlerae to make it more sensitive, and then we figured out that the cats infected with Bartonella koehlerae were not making antibodies to henselae or vinsonii Burkholfi. Nor was this girl, because when we went back and retested her, and when we subsequently tested her, which was published in a scientific journal, she only made antibodies to Bartonella koehlerae. So if we'd had that test at the very beginning, we would have known that she had been exposed to koehlerae, and we could have worked harder on a direct detection to prove that she was infected. I think the most useful aspect of serology is twofold. One, to say that my patient's been exposed and may or may not have Bartonella. And then the second is, once I am convinced my patient has Bartonella, or we have proven by digital PCR or BAPGM enrichment culture, enrichment PCR, that that patient's actually infected, then with treatment, I can follow that antibody titer and look at seroreversions. So early in an infection, detecting DNA is easier. Later, the longer an individual's infected, the harder it's going to be to detect DNA. But if the patient has antibodies, which not everyone that's infected with Bartonella has antibodies, thus the reason to do both types of testing, if they have antibodies and you treat effectively, our experience in dogs and what we published in humans is that if the infection is eliminated, that patient will serorevert to an IFA negative state.